Hello, this is ABIM Review Series. We are going to talk about ABG and COPD patients. The first thing to note here is that COPD patients have chronic respiratory acidosis. COPD exacerbation comes with acute on chronic respiratory acidosis, and what that causes is a big drop in serum pH. But because this is acute on chronic, the acute component does not give you a lot of increase in bicarb. So the increase in bicarb on top of chronic is very little. So there is only a little increase in bicarb, although there is a big drop in serum pH. And if that rule is not followed, that just means that there is something additional going on. There is additional acid-base disorder going on. Now, if we know the rules, we can predict the compensation. And if the compensation is not as per our prediction, there is something else going on, and that helps us solve a lot of questions related to ABG and COPD. So the rules to follow are as follows. COPD exacerbation is acute respiratory acidosis on top of chronic respiratory acidosis. Numbers that I need you to remember in terms of acute respiratory acidosis is 0.1, 1, and 10. I'll tell you what that means. 0.1 is pH, 1 is bicarb, and for acute respiratory acidosis defined by development of respiratory acidosis in less than 4 to 5 days, 10 mm of Hg of 2 retention results in 0.1 decrease in pH, because decrease in pH is acidosis, compensated by 1 milliequivalent per liter increase in bicarb. Regular COPD who has chronic respiratory acidosis, their pH is not too bad, right? Because the pH is only changed a little because there is a good compensation. Let's talk about the general rules. We already know that CO2 and bicarb follow the same direction. Now, if we talk about acute respiratory acidosis, we know that CO2 has to go up. If we keep that constant by saying that CO2 would go up by 10 above 40, 40 being the normal, bicarb should also go up, right? So it goes up by 1 for acute respiratory acidosis. For chronic respiratory acidosis, because kidney would have more time to work because it is chronic, CO2 would go up by 10 from 40 and bicarb will follow. This time is by the factor of 4, right? Because it's chronic and it is more time. Now for alkalosis, CO2 would go down, so 10 below 40. For every 10 below 40, for acute respiratory alkalosis, bicarb will also go down the same direction by 2. For chronic respiratory alkalosis, bicarb will follow CO2. CO2 will go down. For every 10 it goes down by, bicarb will go down by 5 because it has more time to compensate. Kidneys have more time to compensate. If you just remember the number 1425, then that will help you remember the change in bicarb per 10 of change in CO2. And that is how I remember acid-base disorder, especially respiratory. And that helps me the most while dealing with COPD patients. I hope that helps. Take care.